Fusion Mobile, quality e-learning experience on the go.
Sense organs. The body's receptor cells are sensitive to a wide range of stimuli ranging from feelings of sensation, light, sound, taste, movement and orientation of the heat and smell. Sensation of the skin. Receptors sensitive to pressure, temperature, pain, etc. are found in the dermis of the skin. Some are embedded in the lower part of the connective tissues of the dermis. Organ of smell. The olfactory receptors of the nose are found in the roof of nasal cavity with sensory cilia extending into the layer of mucus. Impulses from the cells are transmitted to the olfactory lobe of the cortex for interpretation. Organ of taste. Taste receptors are situated in the taste bud of the tongue surface. Each taste bud is sensitive to only one of sweet, salty, sour and bitter sensations from front of the tongue to the back respectively. The organ of sight. Organ of sight, known as the eye, comprises of the eyelid, the tear gland, the conjunctiva, the sclera, the retina, the cornea, the aqueous humor, the vitreous humor, the lens, the iris, the fovea or the yellow spot, and the optic nerve. The eyelid does a protective job by means of blinking reflex. The tear gland secretes tears which contain antibacterial enzymes called the isozyme. It also prevents drying and cracking as well as washing away of dust. The conjunctiva is a thin epithelium which lines the eyelids and continues across the surface of the eyeball. The sclera, also known as the sclerotic coat, is a layer of tissues behind the retina containing a dark pigment which prevents the reflection of light within the eye. It also contains capillaries which provide food and oxygen for the cells of the retina. The retina contains light-sensitive cells of two kinds, known as the rods, which are sensitive to dim light, and the cones, which are sensitive to brighter light only. The cornea is a transparent part of the sclerotic layer. It is protective in function. The aqueous humor is a fluid occupying the front part of the eye. It helps in maintaining the shape of the eyes and refraction of light. It is lighter than the vitreous humor. It supplies oxygen and food to the cornea and lens. The vitreous humor comprises thick jelly-like fluid which fills the back of the eye. The pressure exerted keeps the eyeball in shape. The lens is a clean structure whose function is focusing of images on the retina. It is held in place by the suspensory ligament. The iris is an extension of the choroid. It regulates the amount of light that enters the eye. The fovea, also known as the yellow spot, is a small area in the retina densely packed with the cone cells. It is the sensitive part of the retina where objects are focused. The optic nerve. The optic nerve carries impulses from the retina to the brain. The point where nerve fibers in the optic leave the retina is the blind spot with neither rod nor cone cells. Functions of the eye. The eye helps in image formation and in accommodation. In image formation, light enters a denser medium like the cornea and lens and is made to refract. This causes the rays to be focused at a point to the retina. The image formed is upside down but is corrected by the optic center of the brain or the cerebral cortex. Accommodation is the ability of the eye to focus an object at varying lengths. In order to accommodate, the eye makes adaptation for rear vision and also adaptation for distant vision. In adaptation for rear vision, the ciliary muscles contract, the suspensory ligament relaxes, the lens also relaxes or assumes normal round shape, and also the focal length shortens. In the adaptation of distant vision, ciliary muscles relax and are pushed outward by the pressure of the vitreous humor. The suspensory ligament contracts due to the tension created. The lens is stretched into an elongated shape and the focal length is increased. Defects or malfunctions of vision. We have the long sight or the hypermetropia, the short sight, also known as the myopia, the astigmatism, night blindness, and the presbyopia. Long sight or hypermetropia is the condition where near objects cannot be focused. It is caused by having small eyeballs or lenses which have lost their elasticity. Objects are focused behind the retina. Loss of elasticity is mainly due to old age and is called presbyopia. In short sight, also known as the myopia, distant objects are unable to be focused. It is caused by too powerful a lens or too large an eyeball. Distant objects are focused in front of the retina. To correct short sight or myopia, the use of diverging lens or biconcave lens is advised. Astigmatism. Astigmatism is a defect of vision caused by irregularities in the curvature of the cornea and the lens. Correction is by wearing cylindrical lenses. Night blindness is a deficiency disease caused by lack of vitamin A. To correct it, more vitamin A should be consumed. Presbyopia. Take 2. Presbyopia. In many old people, the eye lens or ciliary muscles may become inelastic or hardened so that accommodation is reduced. This defect may be corrected with the use of weak convex lenses or bilocal lenses with upper and lower halves. Seeing in dim light. Seeing in dim light involves the dilation of pupil by means of contraction of radial muscles of the iris, adaptation to dim light in the retina due to buildup of a pigment called the rhodospin, use of sides of the eye rather than the use of fovea side of the eyes with more rod cells. In order to take care of the eyes, we are advised to bath with salt solution. We should use a clean handkerchief for cleaning the eyes. We should consult a medical doctor in case of suspected infection. We should also employ the use of antibiotic eye drops, that is, dichloroamphenicol and Vicin, in case it is inflamed or turns reddish. Organ of hearing. The ear, which is the organ of hearing, is divided into 3 regions: the outer ear, the middle ear, and the inner ear. It is deeply situated into the skull for protection. The outer ear contains tubes or external auditory mucus with antiseptic wax produced by wax glands, ear flap or pinna, which directs the sound waves, and the eardrum or tympanum, which is the first point of call of vibration. The middle ear is an air-filled cavity containing 3 small bones called the ossicles, whose function is mainly to transmit and magnify the vibration already started by the tympanum. Eustachian tube reduces the pressure, especially during yawning. The inner ear, also known as the labyrinth, is filled with fluid called the perilymph. It contains the cochlea, through which sound vibrations are converted to nervous impulses. It also contains the semicircular canals with the utriculus and the sacculus, which help to maintain balance. Mechanism of hearing. Sound waves are converted to nervous impulses in the following stages. 1. The waves are picked by pinna and passed down the ear tube, also known as the auditory canal, making it to vibrate. 2. The vibrations of the eardrum set up further vibrations of the ossicles. They act as levers by magnifying sound waves at the end of the stapes. The stapes vibrate against the oval window, thereby setting up vibration in the perilymph. This passes down into the cochlea. 4. The vibration is further transmitted into the endolymph, from where it gets to organ of Corti, where nervous impulses are triggered off along the auditory nerve to the brain and back, and we are made to hear. Balance. Talking about balance, the 3 semicircular canals are sensitive to changes in the direction of movement, while the utriculus and the sacculus are sensitive to the position of the head, as the 3 semicircular canals are at right angles to each other. Each is filled with endolymph, one of which must be affected by every headtone. When the head moves, the fluid moves along with it. This is detected by the ampullae, and that is the reason for one to still feel as if still rotating after having rotated several times. To take care of the ear, we should avoid loud noise. We should clean our ear with cotton buds and avoid using sharp objects, as it can damage the eardrum. we should also seek medical advice in case of any suspected infection.